My name is Tammy Ramanan. I'm an interventional and structural cardiologist at Vitruvian Health. I was raised in Canada, and I grew up there since I was 10 years old. I did my undergrad in Bachelor of Health Sciences and did my master's in public health at the University of Toronto. After that, I actually moved to the States for the rest of my education. So I did my medical school at Michigan State and then did my residency in internal medicine at Case Western University in Cleveland. Following that, I did my fellowship at the University of Buffalo. So that's where I did my general cardiology, my interventional cardiology, and my structural fellowship. Well, I was doing my residency in internal medicine and I got to explore different specialties. The one that really spoke to me was cardiology, mostly because it's a very interesting organ and all other parts of the body really depends on the heart. When I was doing my cardiology fellowship, I got exposed to procedures that we could do to help the heart, and that was what I fell in love with. I love procedures. I love putting catheters into the heart, fixing people's heart arteries. And as I was doing that, I got exposed to doing structural heart as well, which is working on patients' the valves in the heart, closing up holes in patients' hearts. And the unique thing is we do that all through a small hole that we make. And this helps the patient avoid open heart surgery. They can go home the next day. So these are very innovative things that are happening in cardiology, and that's kind of what led me into it. I didn't realize that I was a hands-on person, but once I started doing that, it was just one of those things that is very engaging. And what's amazing is the impact we have on those patients, because when they're coming to us and needing those procedures, oftentimes they're at the most vulnerable part in their life. They're almost dying, and helping give them a second chance, giving them something, opening up the heart artery, resolving their chest pain. At Vitruvian Health, we can provide procedures that they provide at bigger cities. And the beauty of this is that patients don't have to travel to bigger cities to get the care. We provide most complex care here. And it's not just cardiology. We depend on a lot of our specialties at Vitruvian Health, and we work together closely. There are a lot of talented people at Vitruvian Health that can provide a very comprehensive care for our patients. I love our structural procedures because these patients previously had to have open heart surgery, which would require weeks of post-op care, recovery, and it would take them a while to get back to their normal life. But with structural procedures where we make small holes and are able to do similar, repair those valves and replace those valves, they're able to get back to their life within a week or two. And I think that's really cool. I think we've just opened up a lot more options for patients, and that's important. I walk into every room thinking that this might be my family member. What brings them in and their story really matters to me, and that helps me influence the kind of treatment plan we come together with. It's something we come together, the plan comes together with both of us involved. And at the end of the day, getting them back to their life and helping them achieve their dreams and goals is what is important to me. So whatever I can do to help them get there is what I'll provide to them.